So here's the answer to the quiz on the 6th of February. The lesion was the lesion presented is a typical lesion on the scalp. It's a 60-year-old male. I think the age is the only sort of red herring, but clinically it looks quite characteristic. It's a warty lesion, quite well circumscribed, and it's been there for 6 months. Now, obviously, clinically, you would think about at this age, you would want to rule out squamous cell carcinoma, and that's the reason why a biopsy is preferred, even though you may suspect this may be a wart clinically. Now, on histology, what you're seeing here is marked acanthosis, warty hyperkeratosis is what we call this. Now, characteristically, if you see in viral warts, and we've discussed this before, you see this interned reti ridges, and this is typical of viral warts when you see this particular feature, though it is not pathognomonic. Okay, you see mild hypergranulosis, and if you look at higher power, you are seeing some parakeratosis here. You see these nuclei, you're able to see them, compact hyperkeratosis, parakeratosis. The granule layer is thickened, you can see this here, and you can see these coilocytes, and these are typical coilocytes. It can't get any more typical than this. Now, there are no core rounds and grains, and we did discuss core rounds and grains in the last quiz. There are no core rounds or grains. These are just coilocytes. There is no atypia. The cells seem to be maturing really well from the bottom to the top. There is no dysplasia. There are no mitoses. All these are simply coilocytes. These are not abnormal mitotic figures. These are simply coilocytes. And you can appreciate the parakeratosis here as well, though it's slightly out of focus. But yeah, this is not a squamous cell carcinoma, which some of you thought about. So there is no loss of polarity, there is parakeratosis, there is hyperkeratosis, there are no atypical mitotic figures, there are coilocytes are present, hypergranulosis is present, no dysplasia, no acantholysis, no core rounds or grains, and the final diagnosis is a viral wart or verruca. All right, thank you very much.